Hey there, Erica Leon, registered dietitian and certified intuitive eating counselor and eating disorder dietitian. And I've been getting a lot of questions recently about whether someone who is struggling with an eating disorder can start doing intuitive eating. And it's a really good question, and one that I say is really very variable, depending on the kind of eating disorder a person has, how long they've been struggling. And so, in general, when someone is coming out of an eating disorder, particularly a restrictive eating disorder, it's really important to have some sort of meal plan, meal pattern, meal guidance in place, because people's hunger and fullness signals are really way off. It's difficult work to re-nourish a body that's been starving, and so sometimes a person's going to feel overly full. It's kind of a false feeling of fullness, and will think, okay, I have to stop, and we sort of make it into a hunger fullness diet, and that's really not helpful for someone who needs to be working on nutritional rehabilitation. So if someone has, on the other hand, more of a binge eating type of eating situation, the issue of working on intuitive eating, again, approaching it is a little bit different. It's still helpful to have some sort of pattern, an idea of meals at regular intervals, breakfast, lunch, dinner, a couple of different snacks, and then being able to think about, what would it be like to try foods that feel satisfying, and doing experiments, really just what we do in intuitive eating. So I think the real difference between the type of eating disorder and whether you're ready to integrate intuitive eating is where your body is in terms of needing to be nutritionally rehabilitated, because really it's about those hunger fullness cues and being able to be open to feeling sensations inside of your body. But even though people may really be struggling, when I work with someone individually, I always use intuitive eating skills, starting to talk about honoring hunger and fullness, even from the start, and having someone use their meal plan as a base, and then sort of experimenting with trying different snacks that feel satisfying, with introducing foods that have been really kind of scary, and allowing yourself to start to enjoy it and start to incorporate it more into your diet to allow for flexibility. That's really the basis of intuitive eating. And so if you are struggling with an eating disorder, it is helpful to work with a dietitian who understands health at every size and eating disorder recovery. And I invite you to continue learning more about this.